We will now look at the sole of the foot. The structure of the sole is similar to that of the palm. The foot's sole is covered in thick, hairless skin. A few flexure wrinkles can be seen in the skin when the skin moves. It is strongly attached to the deep fascia beneath by multiple fibrous bands. There are sweat glands found in the sole of the foot. Upon dissection, the structures underneath the skin are seen as here. The deep fascia of the sole is specialized to form the plantar aponeurosis in the sole, the transverse metatarsal ligaments between the metatarsophalangeal joints, and the fibrous flexor sheaths in the toes. There is this thick part of plantar fascia, or also called the plantar aponeurosis. The plantar aponeurosis starts at the calcaneus and extends to the toes, where it divides into several smaller bands of tissue that attach to the bones of the toes. It protects the underlying nerves, blood vessels, and muscles. The main function of plantar aponeurosis is to support the arch of the foot and to help distribute the weight of the body evenly across the foot during weight-bearing activities such as walking, running, and jumping. When the plantar aponeurosis is stretched or strained, it can result in a condition called plantar fasciitis. Plantar fasciitis is a condition that causes pain and inflammation in the heel or arch of the foot. It is caused by the strain and overuse of the plantar fascia. Repeated attacks of this condition induce ossification in the posterior attachment of the aponeurosis, forming a calcaneal spur. Pain in the heel or arch of the foot, which is typically worse in the morning or after extended hours of sitting or standing, is the primary sign. Sharp or dull pain that is accompanied by stiffness, swelling, or a burning feeling is all possible. Age, obesity, flat feet, or high arches, repetitive foot stress activities, such as running or leaping, and wearing shoes with inadequate arch support are all risk factors for this condition. Rolling a ball with your foot on the ground is a typical exercise suggested to reduce the pain. Rest, ice, and stretching exercises are frequently used to treat it. Supportive footwear or orthotic inserts are also recommended. To lessen discomfort and inflammation, non-steroidal anti-inflammatory medicines may also be suggested. As for the transverse metatarsal ligaments, these are foreshorts distal to the metatarsophalangeal joints. The digital bands of the plantar aponeurosis are interconnected by transverse fibers, which form superficial transverse metatarsal ligaments. Here is the fibrous flexor sheaths. These fibrous sheaths begin anterior to the metatarsophalangeal joints and extend to the distal phalanges. These are made up of the deep fascia of the toes. These fibrous tunnels hold the tendons to the bony plane and prevent tendon bowing when the toes are flexed. The tendons of the flexor digitorum longus, flexor hallucis longus, and flexor digitorum brevis muscles enter fibrous digital sheaths or tunnels on the plantar aspect of the digits. Their structure is like that of the fibrous flexor sheaths of the fingers. If you wish to learn about the anatomy of the hand in detail, check out our video on upper limb, hand and wrist here at sqadia.com. Moving on, if we look at the cutaneous nerve supply of the sole of the foot, several nerves can be found here. The skin is mainly supplied by 3 cutaneous nerves. The nerves are medial calcanean branches of the tibial nerve to the posterior and medial portions, branches from the medial plantar nerve to the larger anteromedial portion, including the medial 3½ digits or medial 2/3 of the sole, branches from the lateral plantar nerve to the smaller anterolateral portion, including the lateral 1½ digits or lateral third of the sole. Here in this illustration, you can better visualize the distribution of these nerves. The green area here is supplied by the medial calcaneal nerve. The yellow area is supplied by the medial plantar nerve. The pink area is supplied by the lateral plantar nerve. As for these small areas on the medial and lateral sides, they are innervated by saphenous and soral nerves. These nerves are derived from spinal nerves, all 4, 5, and S1.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.